Hello and welcome to this installment of the online EMT program. This is the second section in a 5-part lesson on pathophysiology. In this section, we'll continue to look at the requirements for cellular health. Let's get started. In part 1, I described cell theory and I discussed the complex chemical processes by which a cell creates energy. How about a quick review? Cells are dependent on the delivery of nutrients. These are simple substances produced when our digestive system breaks down the complex foods we eat. Once digestion has occurred, the nutrients are absorbed into the bloodstream. Next, our cells require the delivery of oxygen and the removal of CO2. This is accomplished through two physiological processes: ventilation, the movement of air in and out of the body, and respiration, the process by which individual gases move into the blood and into the cells. Finally, the cells are dependent upon a transport system to deliver what they need and remove what they don't need. This is called perfusion, and we're going to cover it in much greater depth in another section. Now, this ventilation, perfusion, respiration triangle is the foundation of everything we do in respect to patient care. It will be the focus of this and the remaining pathophysiology lessons. In this lesson, I'm going to focus on ventilation. Back in the anatomy and physiology section of the class, I talked briefly about normal ventilation. If you recall, ventilation describes how we move air into and out of the body. This is accomplished by changing the pressures in the thoracic cavity. Air will move from an area of high pressure to an area of low pressure. We divide the ventilatory cycle into 3 phases. Let's start here with the resting phase. At this time, the air pressure in the atmosphere that surrounds us is equal to the air pressure in our lungs. That means there is no air movement. The next phase is the inspiratory cycle. This cycle starts when a nervous stimulus from our brain travels via the peripheral nerves to the diaphragm and the intercostal muscles. The muscles respond by contracting, which effectively increases the size of the chest cavity and the pressure inside drops. The air outside our body will immediately begin to flow in to equalize this pressure difference. Now, stretch receptors in the lungs are triggered when the lungs are adequately filled, and they send a signal back to the brain. On receipt of this signal, the brain stops stimulating the breathing muscles, which relax, causing a decrease in thoracic cavity volume. Now the pressure inside is higher than outside, so the air moves out. On completion of exhalation, we re-enter the resting phase until the next inhalation cycle. Now, this is a really effective system, but it is dependent upon a few things. First, we need open pipes. Our airways conduct the air entering the air into the functional parts of the lung. If these pipes are obstructed or injured, the air may not be able to enter and ventilation is therefore compromised. Second, since that air will enter through any available opening in its attempt to equalize the pressures, we can't have an abnormal opening in the chest. So wounds that affect chest wall integrity, like a gunshot to the chest, can seriously compromise ventilation. Next, we have to have the neuromuscular function that allows us to change the pressures which result in inhalation and exhalation. A serious medical event like a head injury can adversely affect this neuromuscular function. Finally, we need airtight lungs. The air that's routed through the airways is only useful if it stays in the functional areas of the lungs. So when a lung bursts, that air can leak out into the chest cavity, causing all kinds of problems. Okay, now we reviewed normal ventilatory function and the necessary elements for it to occur. Let's now talk about some pathophysiology and some basic treatment considerations. Now, it's fortunate for our patient, but EMS providers are actually very good at identifying and managing many of the problems associated with ventilation. First, we're going to conduct a thorough assessment of ventilatory adequacy. We're going to look at things like rate and quality of breathing. We're going to assess chest rise and fall. We can listen to breath sounds. These are all skills you're going to cover in the patient assessment section of class. And what they do is they help us determine a few things. Is ventilation adequate? And if not, what's the problem? Based on these findings, we can then properly treat our patient. You're going to learn much more about this later in class, but let's discuss a few fundamentals. I think you'll see that there's a lot of common sense involved here. If those pipes are closed or obstructed, we need to try to remove the obstruction and open them. EMTs are able to use several techniques, from simple repositioning of the head to insertion of an airway adjunct. If we find openings in the chest cavity, we immediately cover them and apply an airtight dressing to keep the air from entering. Now, there's no definitive care we can administer if neuromuscular function is lost or if a lung is leaking, but we can support ventilation. We do this by forcing air into the patient's lung with a bag valve mask device. In doing so, we actually take over for the patient's ineffective ventilatory system. All right, now that's it for ventilation. It's the simplest of the ventilation, perfusion, respiration elements in terms of how we assess and treat our patients. In upcoming sections, we're going to look at those other elements.